So one thing we can agree from what you have said is that QPOS is for quality management system. That's what we can agree on. Okay. Now, that means that everything that QPOS represents is to ensure that there is compliance, that there is conformance. QPOS represents quality management system. And because it represents quality management system, and I said everything quality management system is doing is to ensure there is compliance, there is conformance. Now, the idea is that where there is no conformance, we should be able to track it. We are not neglecting the possibility that there won't be compliance. There are many possibilities that there may not be conformance. Something could happen. There can be mistake, as the case may be. Are you getting me? But the idea of quality management system, while it's focusing on making sure that there won't be mistake, while it's focusing on making sure that standard is followed, that there is compliance, that there is conformance, okay? There is also aspect of quality management system that consider that possibility that even after all said and done, there can still be mistake. And what it then means that in quality management system, it has different parts. That's where I'm going with this. And until we understand each of the parts of quality management system, we may not be able to understand fully what QPOS is meant for. You get the point? Okay? Right. So now we might need to go back to ask ourselves, what exactly is quality management system? Because that may be a best way to start. Now, the idea is this. We don't want to run off. We say, okay, QPOS, we can do this and do this. We must understand the principle why that particular, each aspect of the QPOS exists. Okay? So we must, and for us to understand why each part exists, for example, from what you mentioned, there's a difference between audit and I think you mentioned something like reviewing document. There's a difference between audit and documentation. There can be documentation in audit, but they are not the same. Okay, so in QPOS, we must understand why these things are, why we are using each of these parts of the quality management system. And for us to be able to understand the implication of each part of QPOS, we must first of all go back to origin, which is quality management system. The question is already, what is quality management system? So we can't use quality to define quality. You get the gist, okay? So there are three keywords there, which are quality, management, and system. So they don't mean the same. They are different things altogether. All right. So now there are three keywords for this. We have quality, we have management, we have system. So we must understand each of these parts and see how it is embedded on QPOS. Now, at the end of this background I want to set, we need to now go straight to QPOS and start seeing each part. Are you getting me? But for us to understand effectively what each part means, understanding this QPOS, this management system, very, very important. Now, when we say quality, what we are looking at is our target. Do you get the point? Okay, there's expected target. That's quality. What people call standard. Are you getting me? That is quality. So quality is that this is what we are expecting. So when we see that, it gives us a strong indication that we've now met up with the standard. Okay, so quality in a way can also be the way people talk about, which is not, can be when you say, maybe say accuracy, maybe when you say precision, I get maybe when you say reliability, reproducibility. So with quality, this is what we are expecting. This is the standard. This is a control. This is what we want to see. That is quality. Okay. Now, when we talk about management, we know that in order to see those things that we want to see, there has to be guidelines. There has to be rules. Okay? There has to be policies. So we are putting those policies in place And each of the policies or guidelines that we are putting in place, the essence of putting those guidelines or each of them in place is so that when somebody follows that, we believe that in following those policies, we can achieve that target. That becomes management. Now, when you say system now becomes like a structure, like a framework. So we know we have policy, but we cannot scatter the policy everywhere. Are you getting me? So the policy has to follow a particular structure. Let me give you an example. If there is a non-compliance, there are ways we must report it. Are you following me now? Okay. So that's even though we know, okay, let's say we are working together and you offend me. Are you getting me? Okay. Now, there are ways I should report that. If I have a line manager, I may not be expected to rush to the main manager. Do you get the point now? Okay. I'm expected to report it to the manager, to the line manager. So what I mean is that in order to achieve quality management, there has to be a system put in place that will bring about structural framework that should be followed in order to achieve that. Does that make sense? Yeah? Good. So now, when we look at that structural framework, that is a system. When we look at the policy, that is a management. When we look at the target, that's a control or maybe quality. Okay? Now, to now go direct to how it may concern QPOS, we now need to understand that quality management system is a broad subject that, including me that is talking, it will be hard for us to start explaining it by giving it a definition. If you go for interview and they ask you what is quality management system, you don't have enough time to even explain it. So there has to be an understanding to be able to present it comprehensively in a way that it can capture every aspect. Okay? Therefore, in quality management system, for us to get the clear picture of everything, we must understand that there is 12 essential quality management system. Okay? And that 12 essential is these are what the, what's it called, QPOS wants to capture. So for example, when you talk about something like your risk assessment, that risk assessment, like when you mention something like CAPA as the case may be, when you mention something like risk assessment, these are part of quality management system. So in quality management system, we can have organization, okay? We can have customer focus, okay? The essential, you could have organization, you can have customer focus, you can have facilities like the environment and the safety of the environment, okay? So you have customer focus, you have organization, you have facility and the safety, okay? Then you can have personnel, which means the qualification of people who are working there, even as the case may be, the personnel also comes in. They will have purchasing and inventory, which again is also another aspect that will be vital for you as well, okay? Purchasing and inventory, okay? So we can be able to know what do we need, okay? And what's the number of the stock that we have? When do we need to replace it? What do we need to do once it is delivered and all of that, okay? That becomes purchasing and inventory. Then we have equipment. So all those automation or equipment that we can use that can help us, even things like the software that we use, these are forms of equipment. Do you get the point? Okay. So we have equipment, then we have process management, then we have documentation, okay, then we have record, okay. Now these are different forms of quality management system that is a 12 essential. Now there is also another one that we must understand. You know, when you mention something like audit, that audit then is now looking under what we call assessment. Okay? It's looking at assessment. Now, because what I'm trying to bring to you is the fact that if QPOS is about quality management system, that means it has to find a way to capture most of these 12 essentials. That's where I'm going. Okay, so QPOS has to find a way to capture the instrument, has to find a way to capture the inventory and purchasing, has to find a way to capture the assessment, whatever thing, personnel, it has to capture that. All right, so now that is for that. What then is now QPOS? And that is where we now need to take our conversation from. So where I've started was to let us know what quality management system means and link it to the 12 essential quality management system. Now, where we are now is the fact that QPOS, since that QPOS is one of the quality management software, or maybe electronic quality management system, okay, it has to find a way to electronically capture most of these 12 essentials. If we know that the quality management system is to ensure that there is compliance, that there is standard, so QPOS has to find a way to capture electronically to ensure that this definition of quality management system is maintained. And that is what we're going to look at now. Is that all right?
Yes.
Good, let's move on. So when we say QPOS, we are looking at maybe a quality management, software, a quality management software, okay? And this can be widely used in many organizations, but that's commonly like how it concerns us here, okay? It can be used in healthcare, like NHS, okay? Lab or pharmacy, as the case may be, okay? And now the essence of this very QPOS is because it has to support compliance. In other words, it has to support conformance. It has to support quality standard. That is the essence. Now, remember that it is a software. It is not a quality management system as it were. What it does, that it is supporting, the managers, let me use that word, okay? It's supporting the managers to be able to carry out, to do their work. Let me give you an example. I don't want to speed run this. Imagine that you are training somebody, a new member of staff. You are training the person, okay? And you've gone on your, maybe, let's say, annual leave, and you come back. Most times, it will take electronic documentation to know where you stop. Are you following me? To know where to start. Does that make sense? Now, let's say there is an incident that occurs in the lab, and you are raising a CAPA, as the case may be, okay, for that. Now, and you know that CAPA has processes, which we are going to discuss anyway. There are processes that are involved. It's not just about saying something has happened. There are processes that are involved. Now, and most times, as a manager or as a senior personnel, you must be able to track where are we with these things we've raised. Are you getting me? Because when you raise it, may not be when it's going to be completed. I hope you know. So now that processes that it will take place, let's say you are at level 5 and it seems like nothing else is being done about it, and you get cut off with another thing maybe for 2 weeks. Are you getting the point now? Okay, how would you know where you have stopped to know where to start? It is still by this electronic device. Okay, and that is why I said that what QPOS is doing is to support. It's helping us to make sure that this quality management system, QPOS, is helping us to achieve it. And that is the idea I want you to see as we move on. So now in QPOS, it helps us to maintain, international standardization organization. Okay, just for the purpose of what we are doing, I'm going to just mention ISO 15189, but that has to do with the medical labs. Okay, I'm sure it might be different with what's it called now? Okay, pharmacy. Does that make sense? Okay, as the code, that's what I mean. The code would be different. Okay, because 15189 is for lab. That's what I'm saying. Okay. Now, but the code for you guys might be different. So now, what this QPOS is doing is to help to ensure that this compliance is maintained. It also, for us as well, that in the lab, okay, there's what we call UCAS in terms of accreditation. Do you get the point? Okay. So what QPOS does as well to ensure that accreditation process, because even the pharmacy has to be accredited, and even after it has been accredited, we cannot assume because it's been accredited, therefore let's leave it like that. Do you understand? So there still has to be a regulation. There still has to be a check to make sure that the pharmacy is still maintaining the standard we've seen before giving that accreditation. Now, the reason why I'm saying all of this is this, because even though accreditation has been given, but there are rooms for improvement. Okay, and that room for improvement, even the organization, let's say UCAS, that have given you that license to practice, if there is any update, UCAS will also update anybody that they've given the license and say, this is a new thing. Are you getting me? Make sure you implement it. Do you get the point? So now that helps to maintain the accreditation. And the reason why I'm saying this is because remember that don't remove your eye from electronic device. So everything about accreditation, or most things about accreditation, has to do with documentation. We must have a way to trace that we have done this. We must have a way to trace that we have not done this. We must have a way to trace that this is what it used to be. This is now what it is. Let me give you an example. Let's say that the body that accredits the pharmacy. Let's say they've come up and said, okay, this thing that we say is that should be vertical should no longer be vertical. It should not be horizontal. Now, in your documentation, in your QPOS, okay, as a senior, you've written it as vertical. And it has a version for being vertical. So when you change it to horizontal, it is still the same document. All you are doing is to go to that place it said vertical and write horizontal. Every other thing will still remain. But what that will change that, because you have edited from vertical to horizontal, don't come and say it's one word that I edited. No, there is a change. Anytime there's a change on any document, then the version will change. That way, when the accredited body comes, you are able to show them the two versions. Okay? Prior before the change, this was the version. They will look at it and they'll see vertical. Now, after you told us what to do, we have done it. This, that. Are you getting? These two documents, they are still in that software. Are you getting the point? Okay? We are able to trace that this is an old version. Are you getting me? And this is not the new version. So that is what QPOS is there for. So it helps us to be able to track our record of where we are in terms of the quality management. Right. Now, another thing that it does, I've mentioned in terms of the ISO. So now, let me add another layer there. So let's start from the beginning. Let's say there's a hospital that just want to start running pharmacy in that hospital. They were not running pharmacy before, but now they want to run pharmacy. Or they were not running lab before, but now they want to run lab. So they have to make application. They have to notify the regulatory body that, see, we want to start doing this here. Are you getting me? And when they notify them, those ones will say, okay, if we want to do that, this is our requirement. And when these things are sent to you, you know, maybe it can be sent by post, but I'm sure that you have to have a way to document it, to put a record of it electronically. If you leave something only based on hard copy, you may lose it. You might misplace it. The essence of QPOS is to trace what I have done. You can trace what I've done last year. You can still trace it. If it is just leaving it on the table in the office, we may lose it. But with QPOS, are you getting me? We can always trace it. Can I even tell you? The interesting thing about the QPOS is the fact that we can trace it anywhere. If anybody have access, are you getting me? If we can give someone access to access the QPOS, what I mean is that we are not together now. We are talking, virtually. If I give you access to my QPOS, if I give you my username and password, you can access it. So with QPOS, because it's electronically, we can trace. We are not limited with environment. The only time we can have issue if there is a breakdown in that software. Are you getting me? And let me also tell you, even with that, we have a manual version of that software that we can access, should in case there is anything, are you getting me? We can still be able to access the QPOS. If it break down, we can still have a manual method of accessing it while we are trying to repair the, you know what I mean, the version that we're supposed to use. Okay, now let me explain what I mean. In QPOS, if you update something, it's going to update. Once you say maybe save, you have made your change, you say save and all of that, it will update automatically. But we also have another version where we need to keep telling that version, this is what we are doing, but we are not going to, it cannot update automatically. Are you getting me? We have to be doing it manually. The reason why we're having that manual version is should in case this automated version, are you getting me, break down, we can always have a backup. Okay, now the whole point I want to make is that if there's going to be accreditation, there has to be a requirement, and if there's going to be a requirement, those requirements must be traceable electronically. We may miss something if we leave it just based on the like hard copy, meaning that even if they send you you may print hard copy to go through it, but you must always make reference to that electronic version so that to make sure that I've not missed anything. Okay, that's for accreditation. Now, another aspect of the QPOS is the fact that it can help to maintain clinical governance and audit standard. Now, we must understand, that was why I wanted us to, first of all, that was why I decided that we should look at quality management system. You see, like that position they've given you in that band 7, once you cross band 7, you must see your environment from the management point. Do you get the point? Now, let me put it doesn't mean that you no longer dispense medicine. Are you getting me? But maybe a band 5 or a band 4 or whoever, are you getting me? All he's knowing that, okay, we have prescription. Are you getting? They go to whatever and get, sorry, I know because sometimes I can't collect prescription. Okay, what's your name? Emmanuel, okay, they check and all of that. But you, at the senior level, you must see everything that person is doing from the management. And that is what it means to be a band 7 up. So I'm saying that part of the QPOS is to ensure clinical governance. Now, the question now is, what then is clinical governance? In fact, we can say clinical governance and audit standard. We can put it together. They can go together. Clinical governance and audit standard. So we now ask ourselves, what is clinical governance? Explain it this way. You know, I say that as a band 7, you must be seeing something from the management, not from what is going on that counter. Okay, the person on the counter is thinking just whoever he's talking to or she's talking to. Are you getting it? But what you are looking at is, how is all this thing that is going on at the counter? Are you getting me? How is it reflecting our accreditation? How is it maintaining the ISO standard? That is what a band 7 is looking at. That is what a senior member of, is looking at. That is why sometimes at the lower band, people don't understand why maybe a senior may come and maybe you are doing okay, you think there's no problem, but a senior might still say this can improve, or maybe this is not okay. The senior is saying that it is not okay based on where he or she is looking at that thing you are doing. He or she is looking at it from management. So at senior level, your focus is not that something should be done, is that it should be done as prescribed by the ISO. So, and that is what you are monitoring. Now, what then is clinical governance? Let me explain it to you. So, I'm going to make it simple. So, like when we, how will I put this now? Like when after we serve our service users, whether it is their patient, whatever, are you getting me? All the people that will serve in the hospital or lab or pharmacy, whatever, will say, oh, what do you think? What can you say about our services? Are you getting me? Is there any way we can improve and all of that? That's clinical governance. So in clinical governance, what you are looking at is, okay, this thing we are doing, how does that reflect? How does that reflect to the patient's healthcare? How have we Are you getting me? It's not just the activity. That was why I mentioned that, and I said that a senior sees something from the management. Are you getting me? Not just that we have dispensed all the medicine. It is, did we dispense it? Are you getting me? As prescribed by standard. And if we did, the people that received the medicine, how did they see it? Let me give you an example. So you are a senior and you notice that there is a little argument at the counter. Are you getting what I'm trying to say? Okay. Now, that argument, the person that is making that argument may not see clinical governance. Are you following me? May not see the overall clinical governance. He or she is trying to make argument based on, I'm a staff, I'm telling you this is what it is, you know, that kind of thing. But you as a senior, once you look at maybe we are looking at the, what do you guys call it, maybe CCTV camera or whatever, you notice that, you know that that argument will affect the clinical governance, will affect that is not consistent with the standard. You now come and intervene. In fact, they see the younger colleague may feel like you didn't treat him or her well, but what you are seeing is from the quality. So that's clinical governance. So in clinical governance, you are looking at, okay, it's not just we've done this work, how did we even do it? And even after we think within ourselves that we have done this well, what exactly are the opinions of our client? Did they think that they've received the kind of service that we want them, that they should receive? And that is why in most cases we ask them for their opinion, say they should give us feedback. That is clinical governance. So what that is going to help to do for us is to show us areas that we may need to improve on. Obviously, let me add this here for people that will listen to it. There can be bias, and that is where also, as a manager, you must also know when the survey is based on bias. I get what I'm trying to say. But overall, you must be open with your heart to make sure that this thing you are doing, because they are called service users. So anyone using, now remember, the service users are not just the patient. A staff, NHS staff may be sick and also come to the pharmacy to collect. Even you that work in the pharmacy, your prescription can also come there. So it is all about all of us that use that environment, whether they are patient, whether they are staff. Are you getting me? How do we feel about it? And that is where clinical governance comes in. And that also is, that means that it can be called assessment. We are assessing how far have we gone with this thing we've done. And that assessment is also what we call audit. I'm saying that clinical governance is like assessment. And that assessment is also audit. So the question, now we know what clinical governance is, which is about how are we doing? The service we are providing, how does it maintain the standard? And even the people who are receiving those services, what are their opinion about that? Okay, so now the next thing is audit, because they are together. Two of them, they are assessment. The question now is, what is audit? Audit remains assessment. But let me not ask you, just in case I don't want to put you on a spot, but let me tell you this. So with audit, what happened is this. You know, there's okay, let me go this way. The biggest problem people make in quality management system is that they keep saying to maintain standard, to maintain compliance. They are the same. That's why it's called 12 essential. So you must know which parts are you looking at now. All the parts are talking about compliance. They're talking about standard. If you say audit is to ensure standard, you are right. If you say organization is to ensure standard, you are right. If you say personnel is to ensure standard, you are right. But we must know, when we are talking about personnel, what are we referring to? Do you get the gist now? And when we say audit, what exactly are we referring to? If we don't know why that should be the case, we will not know why QPOS is there to assist us to do that. Okay? So if we say these are the guidelines we need to follow to achieve this, what audit is trying to confirm is that, has that guideline been followed? Do you get the gist? So audit is not worried about the end point, The audit is not worried about is a staff. Are they happy? Are the staff, the patient that come to the pharmacy or the counter or whatever to take their medicine, or that come to the whatever? Are you getting me? Audit is not concerned about the happiness, whether the service user, did they enjoy the service? That's not what audit is looking at. Audit is looking at the processes we say you should follow when dealing with the patient. Has it been followed? Do you get the point? That's why it's called assessment. Now, you may think that audit invariably is not talking about the patient being happy. It's not correct. Audit believe that if you follow that thing we've put in place, the patients will be happy. Do you get the gist now? Okay, so audit is looking at that processes, that guidelines we put in place. Has it been followed? So that assessment, that aspect of the quality management system that assess to ensure that the process is put in place to ensure that the standard is maintained has been followed. That is assessment. That is audit. Now, that part of assessment now is a clinical governance. In clinical governance, we are now believing that we have followed the process. We are not worried about, okay, so what did the patient think? Do you understand? But there are still assessment. Okay? So anyway, I said this thing just to mention that in QPOS is trying to help us ensure that it's compliance with the quality standard, like, making sure that we maintain ISO standard, making sure that we maintain accreditation requirement, making sure that we maintain clinical governance and audit standard. Is that okay? Right. While we are here, I'm going to add a little more layer. In audit, there are different types of audit, but I'm not going to worry so much about it. So we have whether vertical, horizontal audit, and witness audit or examination audit. The reason why I'm mentioning this type of audit is that when conducted, we must have the evidence on QPOS. So even though it is audit, we must know the type of audit we are carrying out. Do you get the point? And the type of audit work, and even okay, let me put it this way, even when it comes to the witness audit, let me use your pharmacy for example. I don't know much about it, but let's say it's about arranging medicine. Maybe there are people that should arrange your medicine according to whatever the days of whatever prescription. Then there should be someone that should be able to give it out when somebody comes for it, check it and all of that. Okay, let us assume that is the case. So audit want to see that if I am competent to work, audit want to determine, okay, let me assess that Emmanuel knows how to arrange medication. When audit finish that, audit will record it. I've assessed Emmanuel on this. But before the year finish, Emmanuel need to also be assessed on giving out the medicine. Do you understand what I'm trying to say? Okay. So there has to be a traceability that these are the audit assessment that Emmanuel has gone through. And we should be able to trace it by day, by time, by year on QPOS. So when we bring out the QPOS, we say, so day, by so time, in fact, sometimes so place. This, that was done. And that is QPOS. So QPOS is helping us so that if somebody is querying, if I come and say, I made a mistake, and they say, why? I said, because I was not trained. But you trained me. Are you getting the point? Your evidence is to go, back to that QPOS. Remember, I have my competency file. Even if I have removed let's say I went to that place, I and you agree that, you know what I mean, and I remove it. There is evidence on QPOS. When you raise the evidence, they will ask me, is that not your signature that this was done so and so? Then I said, anyway, the reason why I'm saying all of this is that these are simple, but they are big things. Are you getting me? That is why management appears simple, but it's so elaborate. All right. Okay, I think I've made that point. All right. Now, there are points I want us to look at. So I'm going to start at the beginning. QPOS is a quality management software that can be widely used in the healthcare, and also laboratory, like, of course, obviously NHS, okay? And the reason why for this is to ensure that there's compliance, okay? Quality standard, like maybe ISO standard, or accreditation, like UCAS requirement accreditation, and also to make sure there's compliance in terms of clinical governance and audit standard, okay? Good. Now, the next point I want to mention here is for us to look at what are the points, what are the headings, what do we want to achieve with QPOS? Just in case if we want to write that. Number one, we want to look at document control. Maybe I should give you the list first, then we can move on, okay? So the essence of the QPOS, one of the things QPOS help to support in terms of the quality management system, okay, or quality management of the in, let's say, laboratory or pharmacy, is one, to ensure that's what? Document control. Two, to ensure that it's what? Training and competency. In fact, not to ensure, I think I'm wrong in my statement, to ensure that there is evidence, are you getting me, okay, of documentation control, evidence of training and competency, okay, because they are just having as evidence, okay. Now, audit management, that's number 3. Number 4 is to determine where there is what? Non-conformance or incident reporting. Number 5 is to ensure risk assessment, like risk management, okay? Number 6, to ensure there's equipment and calibration record. Equipment and calibration record. And number 7, to ensure there's continuous improvement. Okay? You see these headings we are looking at, it captured everything about the 12 essential quality management system. That's why when we understand this, we now know which aspect. Remember when I mentioned about 12 essential, I mentioned about document control, something like that. Are you getting me? Now, we now need to ask ourselves, what then is document control?